all of a sudden you stop receiving your monthly visitors. Let us call her Aunt Flo. Aunt Flo goes MIA and no longer comes to the monthly parties. Today we want to know, why did Aunt Flo take a leave of absence and how can we bring Aunt Flo back? Hello everyone, welcome to my channel. My name is Dr. Raisha and here we talk about fertility, women's health and everything in between. So all of a sudden you stop receiving your monthly visitors. Let us call her Aunt Flo. Aunt Flo goes MIA and no longer comes to the monthly parties. Today we want to know, why did Aunt Flo take a leave of absence and how can we bring Aunt Flo back? Amenorrhea. So, amenorrhea is the abnormal absence of menstruation. I want you to take a close look at what we have here. We have two types of amenorrhea. We have primary amenorrhea and secondary amenorrhea. Primary amenorrhea is when a little girl never receives her menstruation. This girl has never received her menstruation at all. Whereas secondary amenorrhea is where you used to receive your menstruation, but for the last 6 months or more, you've not been receiving your menstruation. Now that is what we call secondary amenorrhea. I did an awesome video on the menstrual cycle, and if you have not watched that video yet, I want you to head over there and check it out, because understanding your menstrual cycle will really help you understand what we are talking about today. So if you want to connect the dots, get a full picture of amenorrhea, head over there and watch this video. And I want to do a slight recap of what we talked about. We said that in the menstrual cycle, we have three organs that are really into play. We have the hypothalamus, the pituitary, and the ovaries. We call that the HPO axis. And so here we have the hypothalamus. And here we have the anterior pituitary. We have the ovaries here. And let us add another one, the uterus. The hypothalamus here releases a hormone that we call gonadotropin releasing hormone, which sends signals to the anterior pituitary, telling it to release follicle stimulating hormone and luteinizing hormone. Now, follicle stimulating hormone sends signals to the ovary, telling it to allow the follicles to grow and to mature, so that the most mature follicle will release an egg. And the luteinizing hormone sends signals to the follicle, telling it now to release an egg, what we call ovulation. And if any of these organs is not working properly, this will really affect the menstrual cycle. We talked about primary amenorrhea and secondary amenorrhea. Let us look at some of the causes of primary amenorrhea. We said this is where a girl does not receive even her first period. And the first cause could be structural defects, where this girl is born without an ovary. She's born with an imperforate cervix, where now the cervix cannot open. You know that the cervix has to open to release blood, or even an imperforate hymen. Another thing could be brain tumors or brain disorders. We've seen the importance of the brain in the menstrual cycle, the hypothalamus, the anterior pituitary gland. And when there is a tumor or when there is a disorder in this organ, then it will affect the menstrual cycle. Another thing is chromosomal abnormalities. Maybe this girl is born with some chromosomal abnormalities that could be affecting her menstrual cycle. And now, let us move on to secondary amenorrhea. We said that secondary amenorrhea, this woman used to receive her periods. But all of a sudden, she stopped receiving her periods and has not been having her periods for the last 6 months or even more. We attribute secondary amenorrhea to an underlying condition, a pathological condition. I want you to look closely here. We talked about these three organs, the hypothalamus, the pituitary, the ovary, and even added the uterus. And so, we will start with the hypothalamus. We could have something that we call hypothalamic amenorrhea. And hypothalamic amenorrhea could be caused by things such as physical stress, or even emotional stress. And so, when somebody is stressed, this could be affecting their hypothalamus, affecting the release of the gonadotropin releasing hormone, and hence causing amenorrhea. Another thing is the pituitary. We have something that we call the pituitary amenorrhea. And this could be caused by pituitary tumors. Pituitary tumors are usually non-cancerous, but they could lead to increased secretion of the follicle-stimulating hormone and the luteinizing hormone. And when these hormones are in excessive amounts, this could lead to amenorrhea. And now let us look at the ovary. Now, in the ovary, one could have what we call ovarian tumors. When one has an ovarian tumor, this could affect the release of estrogen, the release of progesterone, which are also key hormones in the menstrual cycle. Another thing is they could have a condition that we call PCOS. PCOS is where there are very many small cysts in the ovary. We will talk about PCOS in our next videos. But I want you to understand that when a person has PCOS, they normally have an ovulation. They do not ovulate. And when a person does not ovulate, there is a high likelihood that they will not receive their menses. And so this could lead to amenorrhea. Another thing is something that we call primary ovarian insufficiency. Primary ovarian insufficiency, this is whereby now a woman reaches menopause before the actual menopause. And some of the causes of primary ovarian insufficiency is maybe whereby this woman has depleted their egg reserves. Women are usually born with a fixed number of eggs. I usually call it all eggs are in one basket. These women are usually born with approximately 1 million to 2 million eggs. And so with time, these eggs are getting depleted. They are getting depleted. They are getting depleted. And this woman, when all these eggs are depleted now, she will have what we call primary ovarian insufficiency. That is the primary ovarian insufficiency. And now we have seen the hypothalamus, the pituitary, and the ovarian. What about now the uterus? Amenorrhea could be caused by injuries to the uterus, some adhesions that could be in her uterus. And this could be caused by maybe this woman had a surgery, something that we call a previous surgery. So this woman had a previous surgery, and during that surgery, she incurred some injury, some adhesions to the uterus. This could lead to amenorrhea. Another thing is maybe she had a procedure that we call dilatation and curettage. And during this procedure, maybe there was some miscarriage, remains, or maybe some injury, leaving adhesions in the uterus. This could lead to amenorrhea. I've said dilatation and curettage. Another cause is hormonal imbalance. Hormonal imbalance is a menace and it is affecting many women. We have seen that there are many hormones that regulate the menstrual cycle. The gonadotropin releasing hormone, the luteinizing hormone, follicle stimulating hormone, estrogen and progesterone. And when there are inadequate levels of any of these hormones, this could lead to amenorrhea. Another one is the hormonal contraception methods, such as the birth control pill, the implant. These methods inhibit the production of luteinizing hormone and follicle stimulating hormone. And when these are not being produced, they also inhibit the production of estrogen and progesterone, and this could lead to amenorrhea. And so, those are some of the causes of secondary amenorrhea. Now, how do we treat secondary amenorrhea? Before treating, the doctor has to know the cause. The doctor has to carry out some investigations. The doctor would like to know what is it that is causing your amenorrhea. Is it an hypothalamic cause? Maybe you have stress. Is it a pituitary tumor? Is it in the ovary? Is it maybe an injury to the uterus? Or maybe are you using any hormonal contraception method? And so, in that, the doctor will perform investigational procedures. They could do maybe a blood test, that is the fertility hormonal assay, where they are looking for levels of certain hormones in your blood, such as the estrogen, progesterone, the follicle stimulating hormone, the luteinizing hormone, the prolactin. They could also do an ultrasound. They could also do an abdominal ultrasound. They could also do an HSG X-ray. After doing the investigations, now we have a clear picture of what is causing your amenorrhea. And so we go ahead now and treat it. And so, if it is physical stress or emotional stress, the doctor could guide you through stress management programs such as relaxation, exercise, yoga, counseling. If it is a hormonal contraceptive method that you are taking, now we could switch to an unhormonal contraception method. Another thing is adopting lifestyle modification techniques such as eating a balanced diet, exercising regularly, losing weight. All these could help you treat amenorrhea. And now to other conditions such as ovarian tumors, pituitary tumors, PCOS, primary ovarian insufficiency. Now, the solution is to get to the root cause of these problems and treat them, and these will help with amenorrhea. And that is it, guys. I hope you have understood how now we can treat amenorrhea, with the causes of amenorrhea,